is Dr. Nupur Kataria, Specialist Periodontist at Melbourne Pericare, and welcome to Periopost, the video show that keeps you up to date with the latest in the field of periodontics and dental implants. In this post, we are going to talk about relevance of periodontitis as we try to place dental implants in patients. When we think about the etiology of periodontal disease, we think about plaque biofilm, and rightly so, because that's one of the major causative factors that affects the periodontal disease. However, there are confounding factors, and we know it's a multifactorial disease. There is smoking, diabetes, genetic factors. Stress has a major role to play. Now, when a tooth becomes periodontally compromised to an extent that it needs to be extracted, dental implants in the recent times have become one of the major modalities of replacing these teeth. But is it a very easy thing to do? Is it a very simplistic way of looking at things? Because when we change the tooth and replace it with the dental implants, none of the other factors actually change. The risk profile of the patient remains to be the same. The case that inspired this post came to me about 2 years ago. She was a lovely lady. Well, she is a lovely lady. She went for a holiday in Holland and she had 3 dental implants placed in the side 2-3, 2-4 and 2-6. Surprisingly, none of the specialists or none of the treating operators over there did any periodontal examination. And she came to me with a presenting concern of a very bad taste in her mouth. There was no access to flossing. She rather didn't know that she had to go and see a dentist or a specialist for regular periodontal maintenance care or dental implant maintenance care. That was a completely alien idea to her. When I actually picked up my probe and placed it in around the dental implants, I was very shocked to see that there was 9 and 10 millimeter probing pocket depths around the implant at the side 2-6 and even around 2-4. 2-3 was spared a little bit, but still had about 5 millimeter probing pocket depths, and there was bleeding, profuse bleeding. During surgical procedure, we could see that there was a very significant bone loss. But what I want you to focus on is that this patient actually had untreated, severe chronic generalized periodontitis. The tooth 2-8, which was extracted eventually, was grade 3 mobile at the time of dental implant placement. Let's look at and delve into this issue further. Recently, there was a study done by Lee and the co-workers and published in 2016. They looked at osseointegration of dental implants in Beagle dog model. Now, they had 6 dogs divided into 2 groups. The control group had regular claims and the experimental group had ligature-induced periodontitis. Again, 6 implants were placed in both the groups. So in total, 12 implants were placed and 4 out of 6 failed in experimental group in dogs where they had untreated periodontitis. And there was reduced bone-to-implant contact and marginal bone density. So implants placed in patients who were treated for periodontal disease are actually associated with higher incidence of biological complications and lower success in survival rate than those placed in a very healthy patient. And severe form of periodontal diseases are associated with high rates of implant loss. What we need to understand is that there is the problem of risk factors remaining unchanged in patients who have had periodontal disease. There is increased risk of peri-implant disease because of poor oral hygiene, residual deep probing pocket depths. So the take-home message of today's video is that every potential implant patient should actually undergo thorough periodontal examination. If a diagnosis of periodontal disease is made, it needs to be treated prior to placing dental implants, and the condition needs to be stabilized and maintained prior to dental implant placement. If you have any queries regarding what we have covered today in our post, or a case that is similar to one that we have posted today, you're more than welcome to come to periopost.com and send us a message, or call us on Melbourne Pericare on 9817 1860. Thank you for your time and keep smiling.